I'm Dr. Jennifer Beck, and I'm staff scientist at the Keenan Research Center at St. Michael's Hospital.
And I'm Dr. Doug Campbell. I'm a neonatologist and director of the Neonatal Intensive Care Unit at St. Mike's.
Our research project basically is helping babies with their breathing. Babies who are born very prematurely, have trouble with their breathing, often need help.
10% of babies are born early or before 37 weeks. And those babies have a much higher risk of breathing problems, lung disease, immature lungs. Our current method of helping babies breathe involves a mask around their face, which is invasive and can even damage their nose and their face. Imagine if we had a vest that could go around the baby's chest and gently pull at the chest to help a baby breathe. That would be less invasive and better for the parents.
The way that babies are currently ventilated is it's the doctor who's deciding the rate and how much air. So it's basically pushing air into the baby's lungs with a disregard to their breathing pattern. And with our technology, it's unique because it's measuring the baby's breathing signals and it's using those breathing signals to control the timing of the breathing.
One of the more exciting things and about this technology is if we can find the right time to use it in a baby, parents can become more naturally involved in the day-to-day care of their infant. And this has already been shown to impact length of stay, improve breastfeeding rates.
At the moment, the design of the vest is a hard shell that is placed around the abdomen and it's sealed towards the chest and the belly button. And what we do is we apply negative pressure inside this vest. And what that does is it's like a vacuum. So every time the baby breathes in, as determined by the breathing signals, we apply negative pressure inside the vest, which lifts the baby's tummy, and that draws air into the lungs.
Remember, these babies breathe anywhere from 60 to 100 breaths every minute. So this is a really high-tech system to detect these breathing movements.
And the initial data that we have from the first 6 subjects doesn't indicate any problems with the vital signs. So I was a competitive squash player when I was younger, and I was always fascinated by why I couldn't run faster or get to the ball faster. And I was always, struggling with my breathing, and I thought I want to study respiratory muscle fatigue in athletes. And I became very interested in the interaction between the patient and the ventilator when I saw my first baby being ventilated with this breathing signal measurement.
I distinctly remember in grade 7, I grew up in Calgary, taking a biology course learning about the human body, and I said, I want to become a doctor. When I studied medicine and then pediatric residency and neonatology or intensive care work with babies, I was fascinated about how to help babies at their most fragile time.
I had this idea that was always sitting in the back of my mind about ventilating babies with negative pressure, but I just didn't know how to go about it to actually achieve this at the bedside. So I approached Doug and in an email, and he wrote back and said, yeah, let's have a chat, and then you can tell the rest of the story if you want.
The original Angel's Den was an opportunity to work with a science team, scientists who are actually right in the Keenan Research Center, to apply what they're studying every day into the clinical environment. So this was unique, and still I think is unique in Canada. Bringing of the minds together in the Angel's Den format was groundbreaking and brought this idea to light, and now it's happening. Yesterday, we put it on a baby. Frankly, it gives you more energy and more hope to keep the ideas flowing, to keep the innovation going.
My goal is to develop the interface to be more handleable, if that's the right word, a lighter material, more see-through, so we can actually see what's happening.
As far as I know, there's no one in the world who is putting together this breathing detection system and negative pressure ventilation with a vest. We are the first in the world. Without this Angel's Den competition, our project would have never gotten off the ground. There would be no NeoVest, and babies wouldn't be breathing in a different way.
I don't think that we would ever have pursued the clinical application of the NeoVest. We have done lab studies, but there was no intention to move forward into the clinical environment until this announcement was made for this grant opportunity. And I would not have met Dr. Campbell and had what I call access to patients. Yeah, I'm very grateful to the foundation for the opportunity.
Yeah, it's a huge win for us personally and professionally, but perhaps more importantly, a huge win for babies.